Having trouble with morning blood sugar spikes? What if the beverage you consume every day might revolutionize the way you manage your diabetes? According to research, some morning drinks can lower HbA1c levels by over 10% and increase insulin sensitivity by up to 20%, protecting your kidneys, heart, and nerves. Imagine beginning your day with a beverage that promotes the health of your complete body in addition to tasting fantastic. Watch as we reveal the top 3 diabetic morning beverages that physicians and scientists recommend. Mornings will never be the same for you again. First, let's have some morning beverages. Melon juice to start. In addition to having a harsh taste, bitter melon juice also has a sharp effect. Its harsh exterior belies its much more enigmatic and unexpected actions inside a diabetic's body. One tiny glass, about 100 to 150 milliliters, includes secret substances including visein, carnitine, and polypeptide P that subtly mimic the actions of insulin. The catch is that these substances really activate actual metabolic pathways rather than merely mimicking them. According to research, bitter melon juice taken in the morning can reduce fasting blood sugar by 20 to 25% and HbA1c by up to 1.2% over the course of several weeks. By activating AMK enzymes, it helps our muscles extract glucose from the bloodstream and inhibits those cunning enzymes that try to convert too many carbohydrates into fat. As a result, there are 18 to 22% less post-meal surges and more consistent crash-free energy throughout the day. This is where things become even more intriguing. This drink conceals a healing cocktail in its 17 calories. Despite having roughly 3.5 grams of total carbohydrates, it only has a glycemic load of 3, so it won't cause blood sugar spikes like fruit juices do. You get a powerful 93 mg of vitamin C from it, a silent warrior that shields your capillaries, enhances arterial tone, and prevents oxidative damage caused by sugar in the kidneys, heart, and eyes. Vitamin B6, a nerve-friendly nutrient that helps long-term diabetics regain neurotransmitter balance, reduce tingling in their limbs, and repair damaged nerve coats. Is also present in 0.38 milligrams. Although the 0.4 milligrams of zinc it contains may not seem like much, the impact is substantial. Low levels of zinc are associated with poor blood sugar regulation. Zinc is the silent powerhouse behind beta cell renewal and enhanced insulin signaling. Its 2.6 gram of fiber acts as a sponge in the stomach, reducing gastric emptying, slowing the absorption of sugar, and allowing your pancreas to react. If this channel helps you manage your diabetes, please leave a remark before continuing. Leave a comment with 0 if you're new. If our content isn't useful, please leave a comment so that we may make it better for diabetics. Let's now discuss the actual magic. The topic is vascular health. Bitter melon juice, which contains 296 milligrams of potassium, decreases systolic pressure by 8 to 10 points, promotes a good salt balance, and relaxes your arteries. Additionally, there is 16 milligrams of magnesium, which promotes heartbeat rhythm, supports vascular flexibility, and reduces inflammation around artery linings. Quercetin, a plant-based antioxidant that may seem inconspicuous but functions as a tiny cleanser, is another component concealed in its profile. It helps prevent neuron and kidney degeneration before it begins, eliminates free radicals, shields the endothelium, and enhances microcirculation. The technique is important to safely obtain all these advantages. To soften strong alkaloids, take 1 tiny bitter melon, remove the seeds, and soak it in water for 20 minutes. Add roughly 100 milliliters of unflavored water and blend. Drink it first thing in the morning after gently straining. Never use artificial additives, citrus, or spices. These may worsen its bitter ingredients or skew absorption. Don't store it overnight or boil it. because of the oxidation that results from the destruction of its plant insulin. Sensitive individuals may experience nausea, cramping in their stomachs, or even hypoglycemia. In rare instances, over 150 milliliters daily may result in elevated liver enzymes, bloating, or diarrhea. Before beginning, people with liver conditions or episodes of low blood sugar should speak with a doctor. However, many people are unaware of this section. This juice targets more than just sugar. It helps the pancreas, calms nerve endings, shields retinal blood vessels, improves kidney filtration, and helps the liver eliminate waste products from metabolism. With time, it builds a more robust, clean, and responsive system that helps diabetics experience better energy balance, fewer sugar crashes, and less nerve discomfort. A secret formula that speaks directly to every diabetic organ that is gradually being attacked is buried behind the bitter taste, which may serve as a warning. Coconut water is number 2. Although coconut water may seem like a simple tropical drink, diabetics might benefit from its subtle yet potent inside effects. Its mild flavor conceals a subtle yet focused impact on your heart and kidneys, nerves, and blood sugar. About 9 grams of natural carbs can be found in just 1 cup of unsweetened coconut water. However, these sugars release gradually, in contrast to sugary beverages. The intriguing thing is that this transparent liquid contains 60 milligrams of magnesium, a mineral that many diabetics are unaware they are deficient in. This lessens recurrent muscular cramping, increases insulin sensitivity, and even soothes nerve irritation that many people experience in their hands and feet. Additionally, it provides a potent 600 milliliters of potassium, which subtly lowers blood pressure, increases vascular flexibility, and aids in the kidney's ability to eliminate excess salt without exerting too much effort. Even more fascinating is the 0.34 milliliters of manganese that is concealed in every cup. It powers potent enzymes that eliminate free radicals, the same ones that erode your nerves, inflame small blood vessels, and gradually harm your pancreas. Additionally, you receive 5.8 milligrams of vitamin C, which helps your body eliminate blood sugar waste, fortifies vein walls, and boosts immunological function. After that, there is a trace amount of B vitamins, including 0.14 milligrams of riboflavin, 0.08 milligrams of B6, and 0.07 milligrams of thiamine. All of them support the metabolism of glucose, repair nerve cells, and maintain more consistent energy levels throughout the day. However, the true miracle is that coconut water reduces fasting blood glucose by 20 to 25%, according to animal research, and gradually lowers HbA1c by over 1%. That isn't a theory. It's a change in biology. It improves insulin sensitivity, boosts muscular glucose uptake, and inhibits digestive enzymes that cause blood sugar spikes after meals. Thus, you get a neater decline and a smoother rise rather than massive sugar swings. This results in improved circulation in your legs, reduced strain on your pancreas, and a clearer head in the morning. This is when things start to get interesting. There's more to this mineral-rich beverage than blood sugar. It increases your body's capacity to supply oxygen to your heart, brain, and eyes, relaxes your arteries, and reduces your systolic blood pressure by as much as 10 points. Coconut water contains antioxidants that prevent cell damage that causes retinopathy and neuropathy, 2 of the most dreaded side effects of diabetes. Drink 150 to 200 milliliters in the morning on an empty stomach to reap the full benefits. The sweet place is there. Avoid boiling it. Don't combine it with fake powders or add sugar or the sweeteners. It can backfire if you consume more than 2 glasses every day. Some people have hyperkalemia, which manifests as symptoms including muscle weakness, numbness, and an erratic heartbeat. This is particularly true for those who have kidney problems or are using blood pressure medications. These are genuine but uncommon. Turmeric latte comes in third. Golden milk, sometimes referred to as turmeric latte, is not only a comforting beverage, but also an effective tool for diabetics. Curcumin, a strong antioxidant that can increase insulin sensitivity by up to 25%, is the main player here, assisting your body in overcoming the obstinate insulin resistance that causes elevated blood sugar levels and improving its response to insulin. Imagine including this colorful beverage into your daily regimen and reducing your HbA1c by almost 1%, a modification that can greatly lower long-term issues. Additionally, it significantly reduces blood sugar increases after meals by about 20% and can lower fasting blood sugar by up to 15%. Because of these benefits, turmeric lattes act as a covert protector against the subtle yet dangerous harm that excessive sugar consumption may do to your entire body. Turmeric lattes are a nutritional goldmine. About 100 milligrams of curcumin, the hidden adversary underlying many diabetic issues, is found in a serving. Curcumin tackles chronic inflammation. It supplies roughly 150 milligrams of calcium, which is necessary for healthy bones and neurological function, and 0.5 milligrams of iron, which supports oxygen transport and helps maintain steady energy levels. Magnesium, which is about 0.4 milligrams per serving, is essential for minimizing diabetic vascular damage because it relaxes blood vessels and increases vascular flexibility. Additionally, it provides a small amount of vitamin C, 5 milligrams, which strengthens the immune system and repairs blood vessels damaged by elevated glucose. However, the advantages don't end there. By shielding nerve cells from oxidative stress, turmeric's anti-inflammatory properties lessen nerve discomfort and delay the development of diabetic neuropathy. By reducing arterial stiffness and systolic blood pressure by 7 to 9 points, it significantly lowers the risk of heart attacks and strokes and actively promotes heart health. Curcumin enhances kidney health by reducing renal stress indicators by over 15%, preventing diabetic harm to these essential organs. Additionally, it supports liver function, which helps the body eliminate toxins and keep a balanced metabolism, two systems that are frequently overworked in diabetes. The preparation of turmeric lattes is the key to maximizing their potential. Add a 1 teaspoon of fresh or premium turmeric powder to 250 milliliters of warm, unsweetened milk or a plant-based milk substitute that has been fortified. For up to 2,000% more absorption of curcumin, add a sprinkle of black pepper, maximizing each drink. Steer clear of sweeteners because they can interfere with blood sugar regulation. To preserve fragile substances, heat gently. Many of the health advantages of turmeric are destroyed by boiling or overheating. By offering your body a mild yet effective protection, consuming it in the morning lays the groundwork for stable blood sugar levels throughout the day. But care must be taken. Because turmeric naturally thins blood, consuming too much of it can raise the risk of bleeding and produce minor nausea or upset stomach. It is not advised to drink more than 3 cups daily. Individuals with gallbladder conditions or those on anticoagulant medications should consult a healthcare professional before making turmeric latte a regular drink. After discovering the top morning beverages for improving your health, it's equally critical to identify those that might be subtly lowering your blood sugar levels. Let's examine the top 3 beverages that people with diabetes should stay away from. First, soft drinks and sugary sodas. Soft beverages and sugary sodas may appear innocuous, but for diabetics, they are ticking time bombs that could cause serious health problems. Each serving of these drinks contains an astounding 30 charge or more of added sugar, which causes blood sugar levels to rise dangerously quickly. Imagine that each time you consume these drinks, your body will be unable to cope with a 50% increase in post-meal glucose surges. Your pancreas is forced to create more insulin as a result of this ongoing overload, which exacerbates insulin resistance by about 25%, making controlling blood sugar seem like an insurmountable task. Frequent ingestion can result in a 1 to 2% increase in HbA1c values. It is a major warning sign for diabetic care. However, sugar does not stop the harm. These sodas increase your risk of heart disease by nearly 30% by causing vascular inflammation, which stiffens your arteries. Additionally, the increased sugar load exacerbates diabetic neuropathy, causing at least 15% more nerve pain and numbness, making day-to-day living an agonizing battle. Nor are your kidneys spared. Consuming too much sugar increases the risk of diabetic neuropathy by 20% and speeds up kidney damage. Furthermore, sugary sodas throw off your cholesterol balance by raising dangerous triglycerides and LDL levels, which worsens vascular health and increases your chance of stroke. Regular use of these sodas weakens your immune system and invites more problems by causing chronic inflammation throughout your body. Diabetics are particularly affected by fatty liver disease, which is caused by the liver fighting off toxic fructose levels. These drinks contribute to weight growth, which exacerbates insulin resistance. Sweetened fruit juices are number 2. Sweetened fruit juices may appear to be a healthy, natural option, but they can really cause serious problems for diabetics. These juices, which have a high sugar content, sometimes up to 30 grams per serving, can produce abrupt and harmful blood sugar spikes, increasing fasting blood glucose by almost 25% and post-meal glucose by more than 35%. When used consistently, such steep increases cause HbA1c levels to rise by roughly 1.2 to 1.5 percentage points, making blood sugar control a never-ending struggle. They also significantly impair insulin resistance and reduce insulin sensitivity. And the harm doesn't end there. By deteriorating vascular health and hardening arteries, this sugar overload attacks the heart and increases the risk of heart disease. It also damages the nerves, which speeds up excruciating diabetic neuropathy, and it puts a great deal of stress on the kidneys, which speeds up diabetic kidney disease. The entire body is affected by these negative consequences, which weaken the immune system, alter metabolism, and leave the body exposed. Many people are unaware that the adverse effects are more than merely sporadic. They can worsen diabetic treatment by causing chronic inflammation, energy slumps, and unintended weight gain. This eventually results in severe vascular problems that impair circulation and harm delicate organs like the feet and eyes. Hidden sugars in bottled drinks are silent foes, and even tiny repeated sips pile up. Consuming fruit juices with added sugar can subtly harm your health by raising your risk of organ damage and hospitalization. The wise decision? Steer clear of them entirely and substitute water or whole fruits. This small change can safeguard your patty, maintain blood sugar stability, and promote long-term health across all systems. 3. Sweet, alcoholic beverages. Although alcoholic sweet cocktails may seem like a festive delight, diabetics should be aware of the substantial risks they pose, which can subtly undermine their health. These beverages frequently have high sugar contents, up to 40 grams per glass, which can cause severe blood sugar spikes. They can increase fasting blood sugar by 20 to 30% and post-meal glucose levels by more than 40%. When ingested regularly, this sugar roller coaster pushes HbA1c levels up by over 1.3 percentage points, making it considerably more difficult to regulate diabetes. It also worsens insulin resistance and lowers insulin sensitivity. The effect penetrates deeply into the organs of the body. By impairing blood vessel function, the combination of added sugar and alcohol puts undue strain on the heart and causes detrimental alterations in vascular health that raise the risk of heart disease. Increased inflammation in the nerves speeds up nerve damage and the symptoms of neuropathy. Toxin accumulation puts additional burden on the kidneys, hastening the course of diabetic kidney disease. All of these actions work together to upset the liver, weaken the immune system, and throw off the system's metabolic equilibrium. Diabetic problems are exacerbated by side effects such as tiredness, dehydration, and insomnia. On the other hand, consuming too much can result in harmful fluctuations in blood sugar levels. To keep your blood sugar levels steady and healthy, and to safeguard your body, you must abstain from these sugary alcoholic beverages. Avoiding inappropriate beverages is only the first step. Let's now examine the 3 best morning routines that can significantly improve your diabetes control and start your day off correctly. First, exercise in the morning. Exercise in the morning is more than just a habit. It can change how the body handles sugar and safeguards organs, making it a lifeline for diabetics. Exercise first thing in the morning can reduce fasting blood glucose by 10 to 20% and cut down on glucose rises after meals by as much as 30%. Keeping blood sugar levels stable when they're most at risk. Regular morning exercise reduces HbA1c by 0.5 to 1% and increases insulin sensitivity by 15 to 25%, according to research, reducing the possibility of issues developing within in silence. By increasing vascular flexibility and decreasing arterial stiffness, this exercise benefits your heart. Crucial because diabetes frequently causes undetected blood vessel damage. Exercise also helps your kidneys and nerves because it lowers oxidative stress and inflammation, which slows the growth of neuropathy. But it can be risky to ignore the intensity. Without the right balance, excessive morning exercise can lead to dangerous stress hormone spikes that exacerbate insulin resistance and produce unpredictable blood sugar swings. Excessive strain can cause harm, exacerbate nerve damage, and raise kidney stress. For diabetics, 30 to 45 minutes of exercise in the morning is typically useful because it allows for consistent blood sugar control without overtaxing the body. You can safely increase your strength, protect your organs, and maintain stable blood sugar by finding a moderate regimen that includes mild resistance training, gentle yoga, or brisk walking. Hydration comes in second. Drinking water in the morning is a simple practice that can have a big impact on diabetics who struggle with blood sugar instability. After waking up, drinking adequate water can minimize post-meal glucose rises by 15 to 20% and fasting blood glucose by 7 to 10%, lowering the blood sugar swings that are secretly harming your organs. Insulin sensitivity can increase by as much as 20% when one is well hydrated. When paired with other healthful practices, it can help cells absorb glucose more effectively and reduce HbA1c by about 0.3 to 0.5%. Since diabetes gradually stiffens arteries and puts strain on the heart, water helps to maintain a healthy blood volume, flush out toxins, and increase vascular flexibility. Dehydration from not drinking enough water might increase insulin resistance by raising stress hormones like cortisol and blood sugar levels. Dehydration thickens blood, which increases the risk of kidney injury and makes it more difficult for the kidneys to filter waste. Because dehydration exacerbates neuropathy symptoms like tingling and numbness, nerves also suffer. Although it is uncommon, dehydration can weaken vital electrolytes, leading to lightheadedness and cramping in the muscles. Balance is therefore essential. Depending on their body weight and level of exercise, diabetics should consume between 1.5 and 2 liters, or 50 to 68 ounces, of water each morning and throughout the day. Third, a breakfast that is well balanced. Eating a healthy meal first thing in the morning may seem like a ritual, but for diabetics, it's a secret that may subtly alter everything. Imagine meals like Greek yogurt with berries and nuts, steel-cut oats, or scrambled eggs with spinach working in the background to reduce your fasting blood glucose by as much as 18% and control those sneaky post-meal glucose spikes by 20 to 25% that discreetly target your blood vessels and neurons. This potent combination does more than just make you feel full. It can increase sensitivity to insulin by 20 to 30% and reduce HbA1c by as much as 1%. These figures, which many people ignore, show how effectively your body manages diabetes on a daily basis. But what if you choose sugary processed foods instead of this important meal? In addition to silently taxing your heart, pancreas, and vascular system, you run the danger of causing sharp spikes in blood sugar that worsen insulin resistance. Organs are already tense. Poor decisions or overeating exacerbate inflammation, accelerating renal deterioration and nerve damage without prior notice. It's not just about calories when it comes to choosing nutrient-dense breakfasts and managing portion sizes. It serves as a covert first line of defense against the invisible damage that diabetes causes to your heart, blood vessels, kidneys, and nerves. It's time to act now that you are aware of the top 3 morning beverages that can actually help you control your diabetes. Make these drinks a daily choice to help manage blood sugar, safeguard your kidneys, heart, and nerves, and enhance your general health. Don't delay. Take action now to witness the difference for yourself. If this was useful to you, please like, share, and subscribe for more easy-to-follow advice that will significantly improve your health journey. The best is what your body deserves.